Yes, welcome to Health Matter. Some minutes ago, we still dey talk there, say Dr. Bat go there around the building to make sure say we chook mouth on things we get to do with health, that is health-related issues. And like we did promise, yes, so he don dey around, he don dey gidigba. Gbangba to make sure say he carry us along as far as this COVID-19 dey concerned and vis-a-vis wetin be the present situation of things on top COVID-19 and even the things wey be say we go do tabi make we no do to stay safe. So welcome to yet another bomber package. Yes, a full one of Health Matter with Dr. Bartholomew Ofegbolam, CEO, Medical Director, Grace Valley. You welcome, sir.
Thank you very much, Chief.
Welcome to the show.
I'm pleased to be back. Good morning, viewers at home and around the world. Permit me to also say Happy Democracy Day in arrears to all Nigerians. Yesterday was our Democracy Day. It was a time to reflect on what it has been so far and where we want to be. And it all borders on all of us to start to take responsibilities concerning our lives, concerning our nation. And on that note, I'll be starting today with a topic we started some few months ago, coronavirus pandemic. But this morning, we'll make it as practicable as possible, okay? In the sense that there were some challenges that we have observed in the last couple of weeks, in situations where people get sick and they do not know exactly what they're expected to do. Some get to private hospitals, some get to general hospitals, some get to government hospitals, but their experiences have been anything but excellent. So these are many more that we'll be looking at today, talking about patient rejection and all whatnot. So we're going to do as much as possible to enable people know what government position is in all of this and what you're expected to do when you fall sick or when you have some set of symptoms. This morning, I would like to start by commending the frontline health workers, the powers that be, talking about the policymakers that have actually been giving us the direction in the response, in our national response to this COVID-19 contagion. I must also commend the efforts of PTF led by the SGF of the Federation, Mr. Boss Mustafa, NCDC, Ministers of Health, Lagos State government, as well as other governments. They've been doing wonderfully well to contain this pandemic. Surprisingly, too, the numbers are not getting any better. They keep going up by the day. In the last couple of days, in the last 4 days, we have seen about 2,380 new cases. I want to start from the 9th of June. Nigeria recorded 663 new cases. On the 10th of June, we saw 409 new cases. By the 11th of June, unarguably what should be our highest daily tally so far, 681. And just over the night, yesterday, we also saw 627 new cases, giving us a total of 2,380 affected individuals in just 4 days. There's also some glimmer of hope. I must also point out that just yesterday, Lagos State government announced that they've successfully treated and discharged about 90 individuals. That is commendable. That brings the total number of people that Lagos State so far treated and discharged to at least over 1,000. I think it should be about 1,000 and some hundreds. That's a good effort that they've made so far. Unfortunately, 399 people have actually lost their lives. Among them are health workers as well. So this is a contagion, this is a pandemic that does not respect anybody, does not respect any profession, does not respect any status, any creed, nor tribe. So it's a fight that we must all fight together. And in the last couple of days, in the last 4 days, about 34 people too were unfortunate to have lost their lives to this contagion. And now this brings me to the opening statement I made, while watching the PTF daily briefing on Thursday, one of the questions that one of the journalists asked was the question that bordered on rejection of patients. And as a health worker, I can tell you that a good number of people, a good number of Nigerians do not actually have a clear idea as to what they can do if they fall sick or if they have some set of symptoms that NCDC have enumerated. So this morning, we are going to look at the position of NCDC and what government is saying that people should do when they're faced with this challenge. Number one, government has said that anybody who has some set of symptoms, the major one is if you have fever, if you have dry cough, and you have difficulty in breathing. Any of these two, plus a number of others, like sore throat, diarrhea, loss of smell, we have that on our screen, diarrhea, catarrh, fatigue, shivering, as well as body pains, headache, that you are expected to call some set of numbers. Now, when you call some set of hotlines, you'll be responded to and you'll be told what to do. Now, there's a link below the picture we have on our screen. I do know that not everybody in Nigeria may be literate enough to open such a link. So this morning, the technical department will avail us with those numbers that we should all reach out to when we have this set of symptoms. That is the government position. We are going to do it in regional basis, in 6 geopolitical zones that we have in Nigeria, so that you can actually copy some of these numbers down. When you're sick, when you have this set of symptoms, this is what you're expected to do. Now, government position is that at the moment, private hospitals are not allowed, are not permitted to treat COVID patients. They've also said that Lagos State, for instance, have actually said that 3 new hospitals have been accredited. But for now, we know only one of them that was previously accredited. There are 2 additional ones that have been accredited. Apart from these 3 hospitals, the other ones are not expected to treat COVID or suspected COVID-related cases. Now, that throws up a number of challenges, not just to the health workers who will interface with this group of patients. How do you make the diagnosis on spot? How do you know who has COVID and who does not have? As a doctor, you're expected to have a high index of suspicion. But I want to quickly point out that I do know that that shouldn't be enough. And unfortunately, too, we do not have rapid test kits that hospitals can use on their own to actually be able to separate the COVID patients from non-COVID patients. And any moment from now, we'll be going into the rainy season. We expect a number of respiratory infections to be on the rise. So how are this group of patients going to cope? How are these hospitals going to cope? I also do know that federal government has actually warned that any hospital that rejects patients will be penalized. So I dare say that the demarcations or the instructions are not clear-cut enough. Okay, so going back to the topic that we have on our hands, coronavirus pandemic. We do know that it was a disease that started earlier this year. And so far, it has ravaged a number of countries. Almost all the whole countries have been affected in one way or the other. It has disrupted lives. It has shattered economies of a number of countries. And as we speak today, the global tally that we have for coronavirus has gone over 7 million. But I want to look at what we have at the moment. Globally, a total of 7.7 million, 7.7 and 26 individuals have been affected. And of course, America still tops the list. In the US, it has affected over 2 million people. 2,116,922 individuals. And of course, second to them is Brazil, with more than 800,000 persons affected in that environment. And third is Russia. Now, let us narrow it down to African sub-region. and then we'll see where we are. South Africa, for now, tops the chart in the whole of Africa with a total number of 61,927 infected persons. Next to South Africa is Egypt. 41,303 individuals have been affected in that country. And of course, Nigeria comes third with 15,181 persons. And this morning, we discovered that we have 627 additional cases. Ghana comes fourth with 10,856 cases. Suffice also to say that the number of individuals affected in the whole of Africa have gone past 200,000 mark. And of course, it has caused a total death. Total deaths in Africa as of today is 6,080. 6,080 individuals have lost their lives. Now, if you look at the figures we have had in the last 2 days, and I do know, going by the information that was provided to us last week, that by June 14th, it's actually going to be tomorrow precisely, that ACDC has actually told us that a number of states will start using GeneXpert machine to actually do COVID tests. So we expect to see rising number of cases in Nigeria. Why is it supposed to be so? As we test more, expectedly, we should get more, okay? Because of the ongoing community transmission. It's also no longer news that a good number of people who are infected at the moment cannot be admitted in government isolation centers. So it is important that we give clear-cut instructions on what people are expected to do when they come down with some of these symptoms that we have mentioned today. Thank you very much.
Okay, a lovely delivery from Dr. Bat. Most definitely, as we take do as you don't do your own literary analysis, what we go do, we say we go on this break, come back, open phone lines for una two to ask them any question, just like lecturer do for class. After your own lecture, you go say, is there any question? So we'll go on this break so that when we come back, we'll go to ask una, is there any question? And on top of that, Health Matter continues in a bit. Go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show wey dey help people. Terms and conditions apply sha o.
Hello, today I'd like to talk to you about how to wear non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.
Today, WHO is publishing updated guidance on the use of masks for control of COVID-19. Here is what's new. In areas with widespread transmission, WHO advises medical masks for all people working in clinical areas of a health facility, not only workers dealing with patients with COVID-19. Second, in areas with community transmission, we advise that people aged 60 years or over, or those with underlying conditions, should wear a medical mask in situations where physical distancing is not possible. Third, WHO has also updated its guidance on the use of masks by the general public in areas with community transmission. In light of evolving evidence, WHO advises that governments should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult, such as on public transport, in shops, or in other confined or crowded environments. Our updated guidance contains new information on the composition of fabric masks based on academic research requested by WHO. Based on this new research, WHO advises that fabric masks should consist of at least 3 layers of different material. Masks are not a replacement for physical distancing, hand hygiene, and other public health measures. WHO will continue to provide the world with advice based on the most up-to-date evidence as part of our commitment to serving the world with science, solutions, and solidarity.
Yes, you're welcome back to the show. You don't hear what Oga Gabriel be tell us. So that is Oga on top of what Health Matter, plus how to wear the fabric face mask. But like I take talk when we go break that time, I say when lecturer teach finish, when lecturer lecture finish, you go say student, is there any question or questions? So time don't reach we go open the phone lines. We say we here where from doctor. We go fit ask the thing wey dey do our mind yaga. On top wetin? On top this COVID-19. Doctor, before we go on that break, a lot of things cut across my mind while you dey talk, which I actually penned down. But let us begin with the symptoms that you highlighted for COVID-19. Baffles me that these symptoms are quite similar with that of person wey dey get malaria. The question now is, I'm not helping you to do your job as a medical doctor, but how now? Because person wey get malaria now, to come out talk saying get malaria now, it be like saying I woke up.
My brother.
Maybe you could take those symptoms again so that you will see for
Yeah,
yourself.
thank you very much. The NCDC position is that if you have cough or fever and one of these sets of symptoms, which I'm going to enumerate once more, we have it on our screen: loss of taste or smell, difficulty breathing, diarrhea, catarrh, fatigue, shivering, body pains, headache, sore throat. Please call your state hotline for advice: covid19.ncdc.gov.ng/contact/. That is the link Now, but for the benefit of those of us who may not be able to open this link, we are going to show those state lines that you're expected to call region by region in the 6 geopolitical zones that we have in Nigeria in the course of the presentation. So that is the position. Now, coming back to the question that he rightly asked, if you're looking at these symptoms, they are the typical symptoms anybody who is coming to hospital or anybody who thinks he or she has malaria or typhoid. At least let's use the 2 commonest disease entities we have in this environment. Truly, the symptoms are basically the same.
Except for the issue of difficulty in breathing.
Sometimes, too, malaria can present with difficulty in breathing. You can see difficulty in breathing in people who have upper respiratory tract infection. People who are asthmatic can present with difficulty in breathing. Okay? Somebody who probably was eating and started choking along the line can also present with difficulty in breathing. So these symptoms are not clear-cut enough. So it depends. Now, it behoves on the doctor's concern to actually have a high index of suspicion. We're actually talking about
Doctor,
symptoms.
does this mean we cannot have malaria? No, is it to have malaria now? Is it a problem? No, let's
we live in a malaria endemic region.
So if we do, and these are the symptoms of malaria, how can I tell a doctor I think I have malaria now that they will not COVID-19 the whole thing?
The doctor will have the benefit of conducting a lab test to at least.
You just said now that you can't test.
No, test for malaria. I'm not talking about test for COVID-19.
Okay,
test COVID-19 is specialized tests that are done in some certain centers. Okay? I think we have a caller.
Okay, Sadiq, good morning.
Yeah, hello, good morning.
How you
Good
doing,
morning,
sir?
Sadiq.
Yeah, I'm fine. Oh. Well, I really appreciate you guys.
Thank
you very much.
Yeah, my question is that is someone who just recovered from COVID-19 be infected again? Because there are a lot of contradictions. Some people may say that once you recover, you will not be infected again. Your blood is now used to it. So can someone, a victim of COVID-19, someone who recovered, can he be reinfected again with the virus? That's my question.
Thank you, Sadiq.
Thank you very much for that very important question.
Yeah,
very
you.
important.
Have a great day. Have a nice weekend.
Thank
You
you
too.
very much, sir. Thank you very much, sir. This is a question that has been agitating the minds of scientific community members. It is a difficult question to answer at the moment. Permit me to also point out that the world as a whole are faced with the same set of challenges. There is nobody that has any prior knowledge concerning this. It's a new virus, it's novel. Okay? Now, but to answer his question, we've seen cases, or we have read about cases in some parts of the world where some previously infected individual that got or that recovered after undergoing treatment were reinfected again for the second time. We've seen that in a number of Asian countries. The last study I read about it said about 180 cases of people who were previously infected, fully recovered, and then got infection for the second time. Now, what we do know about some viral infections is that once you suffer some of the viral infections, example is chickenpox.
Same once in a lifetime.
Yes.
Smallpox.
No longer exists, has been eradicated some more than 40 years ago. Okay, so the answer to that question for now is true. People who were infected previously, got treated and recovered, can actually come down with infection again. But the good thing, still on that same study, that they discovered was that those set of people that got infected the second time were found not to be contagious, meaning that they were unable to infect the people around them. So there are still a lot of unknowns about this coronavirus pandemic, a whole lot of unknowns. There's still a lot that are still being researched. So it is not yet clearly defined, but we have seen cases of people who recovered and became infected again.
Okay, Dr. Bat, we have Musa from Sokoto. Musa, good morning. Oh, we lost that. Musa, try call us back. Dr. Bat, we have mentioned COVID-19 vis-a-vis smoking. I think we did that last week. We've mentioned COVID-19 vis-a-vis some other aspects of our life, but I think we are leaving aside the issue of breastfeeding, sir. what does COVID-19 have any significance, or COVID-19 have vis-a-vis breastfeeding for a mother-to-child thing?
Thank you very much. In medicine, we refer to mother-to-child transmission as vertical transmission.
Vertical transmission.
Yes, so it happens in HIV. Can it happen to an unborn baby? That is not yet known. Can an infected or suspected COVID-19 mother breastfeed her child? Okay, WHO answered that question just on Friday. Now, the position of WHO is that if the woman is strong enough to breastfeed, she should be allowed to breastfeed such an infant. Now, it has been found out that children are not likely. Adults get more infected than children. Okay, so children somehow are able to resist COVID-19. Not that they can't pick it eventually. Okay, but the degree of spread among children is not the same with that of adults.
Sorry, sir, let me hold you a bit. Emeka, good morning.
Yeah, good morning there.
Yeah, our doctor is here, please.
Thank you for the information you are sharing. Please, I want to ask, there is this rule that coronavirus is like any other virus infection, that it stays permanently in the body of whoever that come in contact with it. That means that it's just like hepatitis, that they just reduce the viral load on the body, but it still remains. Is that true?
Thank you very much for that very important question. Yes, I've also had that rumor. I've also read some things along that line as well. Let me cite a case of a medical doctor in China. Of course, we know Caucasians, Chinese are usually white. Yeah. Talking about their skin color, they're fair. Okay, so this doctor, after he suffered COVID-19, he survived though after a series of weeks under intensive care. And then when he survived, he turned black. Or he became like a black person. Unfortunately, that doctor died some few weeks ago because it was a case I followed with a lot of interest. But to answer your question, it is not true that people who suffer COVID-19 will permanently have, but in medicine there's what we call long-term sequelae when someone has suffered a disease. You also mentioned hepatitis, for instance. Hepatitis C is curable, and once you're cured, you're cured. Okay, but hepatitis B is not. So people who suffer from or who recover from COVID-19 may not permanently have a long-term sequelae. It's not that they're going to have it for the rest of their. Once you clear the symptoms, once you clear the virus from your system and you have recovered, what happens is that there are what we call memory T cells that can actually keep a record of those events. That is what is obtainable in some other viral infection, so that in the nearer future, when such an individual comes in contact with such a person, the body develops immunity. The body is able to ward off, having gone through that road before. That is where a layman can understand it. Okay, but not that it will permanently leave, not that it will leave behind a permanent disability. In some people, that may be possible, depending on their degree of affectation to their organs. Thank you very much.
You were talking about vertical transmission, sir.
Yes.
Thank you.
Mother-to-child transmission of COVID-19 has not been proven yet, but breastfeeding mothers who have the disease have been encouraged to go ahead, initiate, and continue to breastfeed their young ones. The benefits outweigh the risk of not breastfeeding such a young child, because the breastfeeding comes with a number of benefits. It strengthens the child, such a baby's immunity to ward off other infections. So looking at it from a holistic angle, it will benefit the child more than not breastfeeding. So for what to say that such a mother shouldn't breastfeed.
Okay, Dr. Bat, vis-a-vis, I know it would actually show the phone numbers now, but yes, while we are prepared to do that, I want to ask, sir, which I know is the question on the lips of so many Nigerians watching. Dr. Bat, the numbers that we want to show now, you as a medical practitioner, how viable are these numbers? Vis-a-vis, I want to also ask again, have you even tried calling any? Let's take Ilyasu. Ilyasu, good morning.
Yeah, good morning. Good morning, sir.
Good morning, sir Ilyasu.
Fine. I appreciate your viewers, your sharing address to the public, sir.
Thank you very much, sir.
My question is this. Is it true that there have not been a cure for any virus?
Thank you very much. Thank you very much. I just mentioned one a while ago. There are cure for a number of viral infections, but there are some of them that at the moment do not have a cure. Let me use hepatitis, for example. Hepatitis B and C are viral infections that are similar in a number of respects. Hepatitis C is curable, while hepatitis B is not. You can only manage it in someone who has it. Okay, so not a clear cut that all viruses cannot be cured. No, that's not the scientific position on that. Thank you very much, sir.
Yeah, we're about to show the numbers, but we're asking the position of these numbers. Let me use the word potency. How quick do people?
Okay, the phone numbers.
Yeah.
Thank you very much. I must cite my experience. I think I've said that before on this show. So I have had to call those numbers myself when one of my patients was down and she called and she was asked to reach out to her doctor. I think it was in the early stages of the pandemic, to reach out to her doctor so that the doctor can also call them. I called those numbers. I just tried the first one once, and another doctor was at the other end to pick my call. Good. And we deliberated, and he gave me all the help I needed. But I can say that about Lagos State. I wouldn't know about some other states. But it's important we show those numbers so that people can have them copied down in their houses.
Good one.
It's important to have them so that people can have them copied down in their houses. We have them in regional basis. Why the numbers are being shown?
Sorry, sir. Our MCR, please don't be too much in a haste to flip. Let people have the access to copy.
There are going to be about 6 clips or thereabout to cover all the geopolitical zones. Now, coming back to the symptoms that you asked me, that somebody with malaria, what will happen in such a situation? Can the person go to hospital again?
Yes.
That is why NCDC has come out to say that every hospital, times have changed. Every hospital, be it private or government-owned, should step up and equip itself in such a way that it can handle all emergencies. It is also true that private hospitals are prohibited or advised not to get involved, but it is a difficult decision to make when you're faced with a patient who is presenting with symptoms. And if you fold your hands and said, these are the symptoms that have been listed to us that we shouldn't, such a person may actually have an easily treatable infection like malaria or probably pneumonia, that if you actually go ahead and treat such a person, the person will pull through. But if such a person is denied care and asked to go to here and there, and he probably goes and couldn't get help, the person may die. And that is what we are saying.
Or contaminate more people at home.
Yes,
more people at
that's
home.
what we are saying, that a number of people who may have challenges, health challenges, may not be able. In fact, their cases may actually not be COVID-related, but they may not be able to obtain care due to these challenges we're having.
Malaria will kill some people.
Yes.
Okay, let's talk about the certification of some private hospitals. We saw that in the news some weeks ago that some private hospitals can treat like about 3 in number, like you rightly said. But Dr. Bat, what are the parameters at which this is decided? What are the prerequisites?
Yes, going by what we were told by the NCDC and as well as federal government and state government. Now, the yardstick is that the hospital must be able to handle cases of biohazard level 4 infectious agents. Okay, so now it requires a whole lot in terms of structures. Okay. It's not that doctors that are in those hospitals cannot work in centers where COVID are managed.
And it's not that they are more qualified.
No. Okay. Somebody like me, I can work in any COVID center comfortably well, and I won't be afraid to do that. Okay. But the fact is that we may be in hospitals where we do not have the structures that will allow us to take in such patients. Okay, because you need to have a separate wing That will have to do with your building, your structure. You need to have a separate wing, a separate entry, and all whatnot. And I can tell you that it is truly and sincerely, honestly speaking,
expensive to.
Yes, not every hospital will be able to. But I do know that in Lagos, for instance, a good number of hospitals, much more than the 3 that have already been accredited, have the capacity to get involved in this business. And I think they should be co-opted. Those ones that have interest and think they can do well in that should actually be enlisted to take part. Okay?
I will just ask this last question because you are in the best position to answer it, and I'll let you go with whatever you have on. Yeah, this last question, sir. When we talk about private, I'm still talking about private again. When we talk about private hospitals now coming into it, are we expecting private charges also, or we're expecting, because COVID-19 is a national thing, and for those that have gone into isolation with the government, we see the kind of treatment they have. I don't think they're even paying that. I stand to be corrected. But for private hospitals, where they come in now, are we expecting private treatment?
Honestly, I don't have an official position on that, but I can tell you as a doctor, I can tell you this as a doctor, any private hospital will charge the right fees if they are getting involved. Now, let me give you an idea of the cost implication of the things that you require when you're managing a COVID or when you're handling a suspected COVID patient. Now, there's what we call PPE. Now, the full PPE that a doctor is expected to buy. Personal protective equipment.
Okay.
The doctor will have a gown. The price range for such a gown, I don't want to mention some brand name, at the moment hovers between 12 to 15,000.
Just for one.
For just one. The doctor will need to have a goggle. He will need to have a face mask. A good N95 face mask will cost in the neighborhood of 4,000 to 7,000. Just one single one. And you need a goggle. I recently procured some goggles from my hospital, 3M goggles. I think I got each one of them for about 4,000 for one. And then you have to wear boots. You have to gloves. So by the time you kit a doctor fully with PPE, the cost of what you have used to kit that doctor will be in the neighborhood of 25 to 30,000. And the doctor will need to work with a lab scientist. We need to work with about 1 or 2 nurses who must equally be kitted with full PPE. So multiply that 30,000 into 4 places. How many private patients will be able to comfortably take that bill without making issues with the hospital? So it's a difficult battle. That is why it's expensive, really. You're not talking about the test yet. Okay, because the person will need to obtain a test from recognized government centers. And I'm happy today that at the moment we have about 33 of molecular laboratories that have the capacity to do COVID tests. That's a great achievement. And I know that in no distant time, about 5 more will be added. So 33 completed that can independently carry out COVID tests. The last set of molecular labs that we activated, one was in Ibadan, Akwa Ibom, and Jigawa, and then 5 are in progress.
Okay, Dr. Bat, for the sake of our next week's edition of the program, we would like to beg you, sir, if you can help us go into the issue of testing. Maybe we should label next week's edition testing. We want to know how much does it even cost. Let's do what we call a findings investigation now. How much does it test, sir? Then these test centers, like you have helped us with the phone lines, if we can even have them on our screen again, we wouldn't mind to know how much does it really cost. What are the procedures? Is it that I won't eat before I go for the test? Okay, if it's 10,000, where can I do it? Vis-a-vis the number of persons that have been tested in Nigeria for now. We would really like to theme or label our next week's edition testing on COVID-19. At this junction, we would like to say a very big thank you, sir.
Yeah, thank you very much. But my last word on testing before we go. Lagos State government, the federal government has said that the only acceptable line of testing is the PCR testing. Antibody testing kits are not validated and not allowed for now. See you next week.
See you next week.